Hi, my name is Dr. Frank Sharp, and I have been asked to say a few words about the upcoming coronavirus vaccination that hopefully will be available in our area very shortly. Yesterday we saw history in that 2.9 million doses of this vaccination were transported, distributed, and administered across our country in the hopes that another 40 million will be available by the end of the year. With that in mind, there's been several questions and concerns about the safety and the efficacy of getting this vaccination. So I wanted to give a little bit of information about it. Vaccinations have been used for over 100 years to help eradicate such diseases as measles, mumps, rubella, polio, and even influenza, also known as flu. However, those vaccinations have differed somewhat from what is available today. Vaccinations have traditionally included bits and pieces of dead viruses as well as weakened viruses in hopes that our body will recognize them as disease and begin to fight that disease. This particular vaccination differs a little bit. It is engineered without the use of coronavirus or COVID-19. It has a molecule called an mRNA, and the mRNA is used to tell our muscle cells to construct what's called a spike protein, which is a protein that is usually found on the surface of a COVID-19 molecule. It sort of tricks our body into recognizing this spike protein and launching a fight against coronavirus in this way without the introduction of the virus itself. At no point does this mRNA have any alteration in our own personal genetic material. Our muscle cells will eventually destroy the mRNA that was used. It is a vaccination that's going to require 2 different doses, one to actually mount the attack as well as to prime the pump in our bodies for when we are eventually exposed to coronavirus. There are other questions I know about safety and efficacy. Certain subgroups such as pregnant women, nursing mothers, children under the age of 16, immunocompromised patients. The research is ongoing regarding these subgroups of patients, and I encourage each and every one to ask their own personal physicians about the risks and benefits and if they personally are a good candidate to receive this vaccination. In all ways, though, it is still important to employ the use of face coverings, personal hygiene, and of course social distancing, in the hopes that all of us will have many safe and healthy holidays to come. Thank you very much.